Hi, welcome to Age Well with Joy. I am Joy Pace, the CEO for AgeSmart Community Resources, your area agency on aging. Today, we have a really exciting topic that I know is on everyone's mind, and that is the COVID-19 vaccine. And we have a wonderful person who's going to share some details about that. It's Dr. Tom Dawdy from Greenville. Tom is a retired family practice physician. He was in private practice for some time, and he was the chief medical officer for the prison in Greenville, and also is currently the chair of the Bond County Board of Health. So, Tom, thank you for joining us today and sharing.
Good morning. Good to be with you.
Yeah. So I know the number one thing people are asking is, how do we get this vaccine? When is it coming out? Can you share a little bit about that?
Well, the first thing I want to emphasize is that things are changing almost virtually every day. So what I will tell you today is what I know now, but that may be different. Illinois program is to try to get everyone in the 1A group vaccinated first. That's the healthcare providers, emergency responders, and also an ongoing program that with the long-term care facilities. When all of the healthcare workers have been offered the vaccine in Illinois, and I think we're getting pretty close to that, then we will be moving into phase 1B. The state IDPH, the Illinois Department of Public Health, has already authorized some local health departments who have offered the vaccine to all their healthcare providers to go ahead and begin vaccinating law enforcement officers and other people such as firefighters. So those vaccination programs are being started this week. We expect to hear soon that phase 1B will open up before very long. Phase 1B is a huge group, and I do just want to emphasize that working through phase B is going to take a long time. It includes frontline essential workers, such as law enforcement and firefighters that I mentioned. It includes grocery store workers, teachers, people who have a lot of face-to-face contact with others in their essential work. It also includes people over age 75. And just last week, the state of Illinois determined that they would also include people age 65 and over in that group. So we're talking about millions of people in Illinois who will be in phase 1B. We expect to have a bit more help with prioritization of vaccine within those groups, but we don't have too much on that yet. I heard yesterday on a call that there would be more information on that coming soon. When these groups are eligible for vaccine, the local health departments will be the primary sources for information on that. Some local health departments are taking names now of people who would like to have the vaccine when it's available. I believe Madison County has had an online survey taking down names. That's not signing up for the vaccine. That's just getting your name on a list. I think a couple of other counties are doing that. In Bond County, people are calling into the health department to get their names on a list.
So can you tell me a little bit about how health departments are getting the vaccine and how much each health department is going to receive?
Yes, I can tell you a bit about that and some pretty significant guidelines that are being used in making that distribution. We are, the Illinois Department of Public Health is trying to distribute the vaccine in an equitable fashion according to the populations that are at greatest risk. For instance, we know that within the African-American population or the Latino population, if those folks get COVID, the incidence of more severe illness is greater, and the risk of death is even greater. In recognition of that, the state is not simply putting out a certain number of doses per capita within a county, but counties that may have higher, a more diverse population, greater percentages of African Americans or Latinos or aged people or other high-risk situations may be getting or will be getting more vaccine than counties that don't have as many people in that high-risk group. There's a great intent to make this a socially equitable distribution of vaccine in recognition of the higher risks for some individuals.
Great. Well, at AgeSmart, we're very concerned because COVID-19 can be devastating to older adults, and it's so critical that people have the right information about the vaccine. We know it's very safe and it's very effective, but can you talk about some of those rumors that are going around that maybe people are hesitant because of them?
Absolutely, and that's a very important issue. This vaccine, the two vaccines that are out now, the Moderna and the Pfizer BioNTech vaccine, which are currently available, are really remarkable vaccines. They use a type of technology called messenger RNA. There is every indication that it is quite safe and amazingly effective. We're talking about overall 95% effectiveness in a vaccine. To put that in context, we often have years where the flu vaccine is 50 to 60% effective. It's 60% effective in a good year, in a real good year. These are gangbusters vaccines as far as effectiveness is concerned. And the other good news is that for people who take the vaccine, in the studies, the people who took the vaccine but still were in that 5% or so who still got COVID, they didn't get very sick. They maybe didn't feel very good. They felt ill, maybe felt like they had the flu or something like that. But no one in those groups had the serious life-threatening illness from COVID. So the vaccine, this vaccine is a big deal. It is based on technology that frankly was already in the works to be used for influenza vaccines. It's a better way to make a vaccine because you can adjust the vaccine very quickly according to variants that occur within the vaccine. That was already in the works by the German company BioNTech working with Pfizer. So this is a new technology for a vaccine on the market. It's not a brand new technology that was just thought up this year. The work has been going on in this technology for quite a while. There are concerns, there have been rumors from some that this messenger RNA will somehow get into the DNA of a person's cells and change it. That is not true. This messenger RNA does not enter into the DNA of a person's cell at all. When the vaccine is given, it goes in, gives a message to make antibodies against certain proteins in the coronavirus, and then the messenger RNA deteriorates. It just goes away. There's no chance of altering your DNA with this vaccine. We've heard a lot of stories about the vaccine causing things like infertility, and perhaps in our AgeSmart group that may not be a real hot button issue, but it may be in some places. There's no evidence whatsoever that it will decrease or cause infertility with the vaccine. Bell's palsy is an issue that has been brought up from time to time. In the studies, the clinical trials with this vaccine, there were either 2 or 3 cases of Bell's palsy. I forget what those were, if it was 2 or 3, but the researchers, and these are independent from the pharmaceutical companies, the researchers that have evaluated that data think at this point that probably was consistent with the incidence of Bell's palsy that would have been occurring in the general population anyway, and they don't think it is likely that was associated with the vaccine. I want to be very honest to say, you know, there are some unknowns with this or with any vaccine. And I'll just, you know, down the road, we will find out more. And hopefully we won't find out anything that's too bad, but there could be. That's a maybe. What I can tell you that is not a maybe is that particularly for older adults, our chance of getting terribly ill and dying is significant with COVID. And there's no comparison of the risk from the vaccine compared to the risk of catching COVID if you're particularly over 75 years of age and significantly over 65. I'm 73 years old, and the first second I get a chance to get that vaccine, get out of my way. I'm going to take it, and I'm a person in my days of practice. I was not a doctor who was the guy who would jump in and prescribe a new drug the first day it came out. I didn't want to be the last person to prescribe that for my patients either. I kind of like to sit back for a little while and watch and see what happened. This is not a situation like that. We're dealing with a life and death situation. What have we had? Over 370,000 Americans have died. Over 17,000 people in Illinois have died. We need to get this vaccine into people. We need to take it ourselves. We're protecting ourselves. We're protecting our families. And that's a big deal. That is a really big deal.
Well, Tom, can you tell a little bit about the people who have gotten COVID? There have been side effects that are going to be long lasting. And it seems like it was a huge percentage of people.
When someone gets COVID, of course, it's primarily a respiratory illness. It attacks the lungs. But if the lungs are not functioning well, it's the job of the lungs to get oxygen around to every cell in our body. They're the source of that oxygen. If the lungs aren't working well and they don't get enough oxygen to the heart, that affects the heart. If it doesn't get enough oxygen to the kidneys, that affects the kidneys. It certainly affects the brain. There are people who have had COVID who've had significant worsening of cognitive skills after having, or those cognitive skills seem slow to come back. There are young and usually very healthy people even who've gotten COVID, who've gotten extremely ill with this and continue to have relatively at least months of fatigue, not feeling well, complaining of foggy thinking and things like that for a long time after having the illness.
So a couple other things, we're getting a lot of questions about how will the second dose be available and how will people know to get it?
The plan as it currently stands in Illinois right now is that when you get the first dose, you will get a card that says on there when your second dose should be given. And with the Pfizer vaccine, it's about 21 days later. With the Moderna vaccine, it's about 28 days. And you will get a card to notify you of that. There is also a system called EM Tracker that the state has contracted with. Not every county will necessarily be using it, but that will have the ability to provide electronic notification to you when your second dose is due. Now, you may still need to call the place that you got that first dose to be sure that they have vaccine in and have it to give, but that's how the system should work. Now, there's talk now about not withholding doses for second vaccine and giving everybody first single doses. I don't know where that's going to go. I can't speculate on how that's going to work if that happens.
So then with the two vaccines, is one better than others? You know, there has been some conversation about one's better for older adults than the other.
In the clinical trials thus far, for people who were over, for Pfizer, the Pfizer vaccine across the board was about 95% effectiveness. For the Moderna vaccine, for people over, I think it was age 65, the Moderna vaccine was a tad less effective. The Moderna vaccine came in at about 86%. But you know, that is not a huge difference. And I would urge anybody to get either vaccine as soon as they're eligible to receive it. And the big point of it is that the protection that it appears that these vaccines give from getting terribly ill, protection from dying, protection from hospitalization, whether even if you still get COVID after the vaccine. So it still provides good protection, even if you're not in that 86% or if you're in that that potential 14% with the Moderna vaccine that still might get COVID, you're still getting a lot of protection from the vaccine.
And we know that Medicare is going to pay for the vaccine, but how about folks that are younger than the people that are Medicare eligible? How will they pay for it?
The vaccine is actually purchased by the federal government and distributed through the federal government. There will be no charge for the vaccine itself for anyone who's eligible for it. Now, it is possible that some areas giving the vaccine might have an administration charge. I can't tell you what folks are going to do with that. My guess is that would only be an administration charge that was covered by the individual's insurance.
That's great.
I don't expect people to be paying out of pocket for this vaccine at all. And no one is going to be denied the vaccine for lack of ability to pay.
So cost is not an issue.
Cost is not an issue.
So, and then a couple other questions that keep coming up, and it's like, well, do we still have to wear masks? Do we still have to social distance? What about that?
You're not going to like my answer. For now, yes, we do. We still need to mask. We still need to socially distance. And even at this point, if you are exposed to someone who has COVID and you're a close contact, even though you've had the vaccine, you will be asked to quarantine. We are hoping to see a change in the quarantine requirement before very long, but that has not been determined yet. Masking and social distancing, I think it's going to be around for months yet. And here's the reason, or a couple of reasons for that. Reason one is there are a few people who aren't going to be protected by the vaccine, and we need to recognize that. The other thing that we don't know is if you get the vaccine and you get a mild case of COVID, or maybe even don't know you have it, are you still infectious to other people?
Mm.
And the answer to that isn't known. And frankly, that's not going to be known probably for some time. So the decision is that it's going to be a good idea to stay with masking and social distancing for a good while. Don't expect that to go away soon.
And then my one last question is, how long are these vaccines effective?
That also is an unknown because the vaccines haven't been around for that long. So there's no good way to determine that. We expect that that the 2 doses are going to provide protection for a good period of time. I saw a statement from Moderna just within the last 24 hours that they are expecting that their vaccine will be good for a couple of years. But keep in mind that all viruses mutate all the time. They change a little bit. As a matter of fact, with the coronavirus, about a mutation a week is turning up in the United States. Most of them don't make any difference. They're minor kinds of things, but the virus changes a little bit. Viruses are smart. They try to adapt to still be able to do what they want to do. With the vaccine for coronavirus, it may be that next year, because of mutations, we might have a different vaccine, or there might be a different vaccine in 6 months because of a mutation in the virus that where the vaccine isn't providing the protection that we'd like to see with it. That's one of the beauties of the mRNA vaccines, is it is much easier to make those vaccine adjustments in the vaccine when you know that a change needs to be made. I think everybody's probably reasonably familiar with the flu vaccine, where the virus is grown on chicken eggs, and to decide months ahead what protection you're going to put into that vaccine, and then you grow it on the chicken eggs in starting that in spring or summer, and then that's the vaccine you've got in the fall, and you really can't do much to change it at that point. We can pivot much more quickly with the mRNA type of vaccine.
So those mutations,
go ahead.
Those mutations, is that why people who have had COVID should also consider vaccination?
Yes, two things there. Again, we don't know for sure how long it will last. And also just covering for the vaccine does cover for more than one protein in the virus. So if one of the proteins and the spike proteins in the virus changes, the vaccine should still be able to hit some others.
Oh, that's great. Well, I can't tell you, I feel much more educated now after hearing you talk, and I'm certainly hoping that we can get through that 1B quite quickly and get as many people vaccinated as possible and get back to some kind of normal.
Well, thanks for the opportunity to talk about this. It is near and dear to my heart.
Absolutely. And I thank you for all you're doing, and thanks for your time. Certainly
Anytime.
appreciate it.
Good to talk with you, Joy.